Now, let's review the risk factors of one getting angina. In other words, chest pain. So first, we have diabetes mellitus. Second, we have hyperlipidemia. Third, we have hypertension. And fourth, we have cigarette smoking. So let's concentrate on these 4 factors first. This model is representing the gastrointestinal system. Here, you can see that his liver is shown in purple. His stomach, which is attached to his esophagus, small colon, and large intestine, is shown here in brown. Next, we have this organ that's very important that sits right in front of the stomach, and that is the pancreas. The pancreas, as represented here, is known to make fine pieces of specimen. These specimens are called insulin. Insulin is located throughout our body in our bloodstream, and they are on a hunt. They are on a hunt to find, here in green, these molecules called glucose. Glucose is eaten by insulin. But what happens when there is not enough insulin? This causes a buildup of glucose throughout the system. That means more glucose in the bloodstream, less glucose absorbed in the cells to be used, and more damage to our arteries. Now, what do I mean by damage? Let's cycle back to the image of the artery. Here you see a picture of the artery. The artery is red, it has oxygenated blood, and within the blood, there is what you see here in yellow, cholesterol. Too much cholesterol can cause hyperlipidemia. Then, in the bloodstream, alongside cholesterol, if we think back on what was green, it was our glucose molecules. Glucose molecules in excess is traveling through our bloodstream. Down it goes, down it goes. And remember, excess glucose in the bloodstream can cause diabetes. Not only is cholesterol and glucose traveling the bloodstream, but here we have these brown lightning rods. What would they be? If a person had been a smoker, you would also have cigarette toxins traveling through the bloodstream. Now that we've included the top 3 damaging molecules inside the arteries, we can also include other environmental pollutants that get into our bloodstream and also are of no use to us. So as the abrasive glucose, cigarette smoke, environmental pollutants are traveling down the arteries and is cutting and scraping and slicing the arteries because they're so abrasive, over time, you get cuts and abrasions. And what happens? Cholesterol and other debris get caught in the crevices of the arteries. Then you have oxygenated blood in the arteries attempting to get around the debris that has built up in these cuts and crevices inside of the artery. And with such difficulty, and each cardiac cell yearning for more oxygen, for more blood with oxygen to be delivered, saying, feed me, I need oxygen, I need blood delivered to me. So in response, the heart begins to pump faster and harder to get around the crevices that has built over time, the mountains and mountains of debris that has developed inside of the arteries, which ends up resulting in hypertension, in other words, high blood pressure, our third factor. Now, you can't assume that these issues develop from when we were a baby, when we were a toddler, when we were in our middle age, or into old age. But at what point do you become the highest risk factor? Can anybody guess? Yep, right after your 45th birthday, men and women, you have graduated and entered the danger zone. The danger zone developed over years, and you become more likely to experience angina due to all of these risk factors. So let's get out our cigarette and really think about this. Let's just say that we have all 5 factors. We smoke, we have high cholesterol, we have high blood pressure, we are older than 45, and then we find out that, guess what? Grandma had high cholesterol and high blood pressure, auntie had a heart attack, great grandpa was a smoker and he had high blood pressure with high cholesterol and a heart attack. Uncle had a genetic condition that caused high cholesterol, which led him to get a heart attack. Cousin had high cholesterol, but due to a lot of stress, she had a heart attack and passed away at a young age. Wow, what a family tree. And if you have family members with all of these risk factors, well, you're at the very same risk. Our 7th and very last risk factor is having low high-density lipoprotein. Now, what does this mean? Let's just say in this image, we have cholesterol. Cholesterol is traveling through our bloodstream. We have lots of cholesterol building up in our bloodstream. Now, who is to remove the cholesterol? Yes, you didn't guess it right. High-density lipoprotein. High-density lipoprotein is found in our bloodstream and is known to pick up the cholesterol and remove it to bring it back to the liver. Therefore, if there's not enough HDL to remove the high amounts of cholesterol, all the cholesterol traveling in the bloodstream is available to get into the crevices that the damaged molecules have made to the arteries. The most effective way to increase HDL or high lipoprotein is to get exercise, control the diet, control smoking, and to control alcohol consumption. Thank you for reviewing with me the 7 highest risk factors for one getting angina.